Onto the government's new COVID-19 headache. And hospitals in the capital are struggling to cope and treat COVID-19 patients as the virus spreads to all the small corners of the capital and its environs. Now, the situation has forced the government to turn to the Kenya medical training centers in the city, changing them from quarantine centers to isolation centers, even though the cabinet secretary in charge of health denies that there are no more beds in the city. Recent events suggest otherwise. Enoch Sokolia has more.
Hospitals in Nairobi are overwhelmed, unable to cope with an influx of COVID-19 patients as confirmed cases in Kenya nears the 20,000 mark. 544 new infections were reported by the Health Ministry on Wednesday. But the real figures are believed to be much higher due to the low-level testing in the country. The total confirmed number of coronavirus infections now at 19,125, 875 shy of 20,000 mark.
We need to assist each other. The way the doctors act for us, the way they give themselves to us, the way they participate in saving our lives is a way that we should try and emulate in saving each other.
Even though numbers are growing in new locations across the country, Nairobi remains to be the biggest and hardest hit county. Of the 544 cases reported on Wednesday, 326 were from the capital, meaning only 218 cases were from the remaining 46 counties. But worth to note is that out of the 218 cases, 95 were reported from the counties of Kiambu, Kajiado, and Machakos, regions that neighbor the capital. The Medical Practitioners and Dentist Council says the concentration of the virus in Nairobi and its environs is taking a toll on Kenya's largest healthcare facilities, both public and private.
The facilities have been full. Kenyatta Hospital has been full. Nairobi Hospital is almost up to the capacity. Aga Khan is almost full. So where will we take the rest?
So stretched is Nairobi that hospitals like the Nairobi Hospital, KU Hospital, and Mbagathi are reported to be full and no longer admitting COVID-19 patients owing to lack of isolation and ICU beds. And the government has been forced to rewire its plans to ensure hospitals in Nairobi are not completely overrun by the virus.
Next week, we are launching extra facilities for treatment at Kenyatta University Referral and Training Hospital. We have put the 500 beds I spoke about, 60 of which are ICU. ICU is an ICU facility.
They've always had room, even for over 1,000. But it is making them isolation. They are not building new facility in KU. No, not at all. They already have them. It's already done.
With numbers continuing to swell, the government turned to the home-based care program to free up hospital beds for seriously ill COVID-19 patients. But the reality is that numbers from Nairobi's informal settlements like Kibra are growing fast. And in these areas, home-based care is almost impractical. And now there is a call for more isolation centers in the capital.
So going forward, we've been asked, even as of yesterday, to come up with 2,000 beds for quarantine and isolation in the next 2 weeks. KMTC has already been given the go-ahead. They were the ones that we used as quarantine to start with. We've abandoned quarantine for KMTC. They've become now isolation centers.
Enoch Sokolia, Citizen TV, Nairobi.